I want to start with this mixing and matching, which, we've discussed before, but now, there's this report. One of the sources is the New York Times, Wall Street Journal is another, saying the FDA is planning to allow people to get a different COVID booster shot than what they initially received. And especially this seems to be appealing when it comes to J&J recipients.
Yes, to a certain extent, this has been occurring already in Europe. We know that early in the pandemic, when many countries in Europe were using AstraZeneca and they found the efficacy to be relatively low, they received a second dose of an mRNA vaccine. There's also several studies that have come out recently that I think are under review by the FDA that may suggest some benefit to crossover between, for example, Pfizer and Moderna, or as you pointed out, Johnson and Johnson and one of the mRNA vaccines. I think a lot of that data is yet to be determined, but it seems likely to me that that will come to fruition.
So right now, when we take a look at the data that is out there, it's a relatively small study, the one done by the NIH I'm speaking about specifically, but it takes a look at antibody levels. But right now, we don't know, some of the other in-depth things like the immune cells and how they're going to respond. But right now, it seems promising.
That's correct. And the antibody question comes up frequently in conversation. I think some of the more interesting data from a clinical perspective will be how many patients had a breakthrough infection. Of those who had a breakthrough infection, how many of those required hospitalization or, God forbid, died from their infection. So the antibody levels provide some detail of information of the body's response, but it doesn't, for example, capture the response of something called a memory T cell, which is ultimately responsible for your long-term response to infection.
So now, what type of a difference do you think it will make for providers, including, a Northwell, to be able to use discretion and offer different brands?
I think one of the things that patients are looking for is an opportunity to have these kinds of conversations with their provider, with their family practice provider, with the upcoming pediatric vaccinations with their pediatricians, to help identify which vaccines they feel really fits the bill rather for them most. I think right now, as a healthcare institution, our responsibility is to provide an evidence-based approach to vaccination, and we'll follow the FDA's guidance as well as that of the Department of Health.